Assalamu alaikum. Our new topic for discussion is hemostasis and blood clotting, and today we'll be doing the platelets. The platelets are formed elements present in the blood just like RBCs or the red blood cells. We do not call them cells as the RBCs should also be not called cells because they do not have a nucleus and they cannot reproduce. Similarly, the platelets also do not have a nucleus and they cannot reproduce. These formed elements in the blood are membrane bound, disc-like structure, and they have a small size 1 to 4 microns, and average you can say 1.5 micron meters. They are colorless, and when you see a wet film of the blood under the microscope, they are like shining, glistening body because they are refractile in nature. The number in the blood is 250,000 per cubic millimeter of the blood, and the normal range is 150 to 350,000 per cubic millimeter. The energy production for platelets is by breakdown of glucose, and it's so extensive because there's so much enzymatic work is going on in the platelets that the ATP content of the platelets is 150 times more than the red blood cells. क्या हम इस वक्त कंपेयर कर सकते हैं प्लेटलेट्स की एनर्जी रिक्वायरमेंट्स और रेड ब्लड सेल्स की एनर्जी रिक्वायरमेंट्स को? We see that the red blood cells are packets of hemoglobin actually with a little enzymes in them, and the energy source is by HMP shunt that does not produce much energy as compared to the citric acid cycle that produces a large amount of energy. So the platelets are using citric acid cycle for glucose breakdown, and all those enzymes are present in the platelets and their ATP content is quite high. The lifespan of the platelets in bloodstream is 10 days. These platelets are stored in the spleen. It is said that 80% of the total platelets in the body are circulating in the blood and 20% are present in the spleen. And the other function of the spleen for platelets is that it destroys the old worn out platelets by the tissue macrophages present in the spleen. Continuing with the description of the platelets, the cytoplasm of the platelets is highly bright blue colored and it contains granules that have got glycogen and ferritin in them. It also contains lipid inclusions and small mitochondria. The residuals of endoplasmic reticulum and Golgi apparatus, in nucleus तो चला गया लेकिन ये दो चीजें मौजूद हैं. The residuals of the endoplasmic reticulum and the Golgi apparatus synthesize various enzymes and store large quantities of the calcium ions. The membrane has got proteins 60%, lipids 15%, and carbohydrate 8%. The glycoproteins on the surface of the platelets can adhere to exposed collagen and injured endothelium, but they repel the smooth endothelium and do not attach to the smooth endothelium. The proteins in the platelets are thrombostatin, albumin, prealbumin, fibrinogen, immunoglobulin G, immunoglobulin M, प्लाज्मिनोजेन, मैग्नीशियम कैल्शियम एटीपीएस। सोडियम पोटेशियम एटीपीएस का पता है ना, वो सोडियम और पोटेशियम को एक्सचेंज करते हैं। मैग्नीशियम कैल्शियम एटीपीएस एनर्जी यूज करके मैग्नीशियम और कैल्शियम को सेल मेम्ब्रेन पर एक्सचेंज करता है। एंड अ फ्यू अदर प्रोटीन्स, the thrombostanin and actin and myosin, these are the contractile proteins of the platelets, and they are used for platelet contraction and for degranulation. So platelet contraction, when it contracts, it causes degranulation, जो भी इसके अंदर granules हैं वो बाहर निकल जाते हैं, and it is also used for clot retraction. The proteins present on the surface of the platelets can bind thrombin, epinephrine, and ADP. So they can bind thrombin, epinephrine, and ADP. The fibrin stabilizing factor is another protein present in the platelets and it is used in clotting. So इसकी तमाम discussion हम clotting के दौरान करेंगे. The platelet derived growth factor. The platelet-derived growth factor is a growth factor for vascular endothelial cells. अब आपकी blood vessel injure हुई है तो वहां पर the vascular endothelial cells will grow when the platelets release their platelet-derived growth factor. Underneath the vascular endothelium is the smooth muscle in the blood vessels, and it also grows with the help of platelet-derived growth factor. It also helps to let the growth of fibroblasts to come over and repair the damaged vascular wall. अगर कोई बड़ा डैमेज है ना वास्कुलर वॉल में और एंडोथेलियल सेल उस गैप को फिल नहीं कर सकती, तो ये जो प्लेटलेट डिराइव्ड ग्रोथ फैक्टर है ये फाइब्रोब्लास्ट को एक्टिवेट करके वहां पर डैमेज्ड वास्कुलर वॉल को रिपेयर करने में मदद करता है. Continuing with the description of the platelets, now we come to the platelet granules. There are lysozymes in certain granules. Lysozymes को आप cells में पढ़ चुके हैं कि ये breakdown of the cell structure भी कर सकते हैं और ये eating of certain foreign objects में भी काम आते हैं. So the lysozymes and these enzymes in the lysozymes are containing glycosidase and heparinase. What is heparinase? Of course, you will come to know when you study the anti-clotting mechanisms. Dense granules in the platelets have calcium, serotonin, ADP, ATP, and DTP. So you are seeing that these ADP, ATP, and DTP are stored in the platelets in the form of granules. Serotonin is stored there, and calcium is also stored in the platelets. The alpha granules, they have got platelet derived growth factor. What is platelet derived growth factor? हमने पीछे डिस्कस कर लिया है. Von Willebrand factor, वो क्या चीज होती है? We shall be discussing in the clotting. Fibronectin and heparin neutralizing factor are also present in granules in the platelets. And then there are platelet phospholipids. These will activate blood clotting और जो इसका रोल है जब हम clotting पढ़ेंगे तो ज़्यादा वाज़ेह होकर सामने आ जाएगा. Coming to the genesis of the blood cells, ये आपने डायग्राम सारी पहले देखी है, इसे हमने डिस्कस किया था जब हम रेड ब्लड सेल्स बना रहे थे और यही वो डायग्राम है जो हमने आपको दी थी होमवर्क में कि आपने स्लाइड्स में इसकी स्केच बना के लाना है और यही वो डायग्राम है जिसमें से हम प्लेटलेट की फॉर्मेशन को देखेंगे. So the hematopoietic stem cell in the bone marrow, and in the hematopoietic microenvironment which contains hematopoietic stem cells and these colony stimulating factors and these interleukins, committed stem cells are produced. One of these committed stem cells or the progenitor cells is GM-CSF, thrombo, जिसने थ्रोम्बोसाइट्स या प्लेटलेट्स बनाने हैं, प्लेटलेट्स को थ्रोम्बोसाइट्स भी कहते हैं, जिस प्रिकर्सर ने कमिटेड स्टेम सेल ने आगे जाकर प्लेटलेट्स बनाने हैं वो कहलाता है जीएम कॉलोनी स्टिमुलेटिंग थ्रोम्बो. ठीक है. So this thrombocytes committed stem cell under the effect of thrombopoietin converts into megakaryocyte. The megakaryocyte is so this is megakaryocyte. There are small platelets formed in the cytoplasm of this megakaryocyte. The cell size is 35 to 160 microns. It is present in the bone marrow along with other cell structures, that is developing leukocytes and developing erythrocytes in the same bone marrow, and this megakaryocyte is also present in the same bone marrow. The platelets are small membrane-bound cytoplasmic fragments shed off the outer edges of the large megakaryocyte. A single megakaryocyte produces about 1,000 platelets. The hormone thrombopoietin produced in the liver stimulates megakaryocyte formation and platelets production. Now, this platelet production is affected by certain factors that decrease it and the other factors that increase it. The factors that affect decrease in the platelet count are newborn. The newborn has got less platelet count, and then there is menstrual cycle. The last 14 days of the cycle show a continuous decline in the platelet count. Once the menstrual cycle starts, the count increases rapidly and it starts decreasing at the ovulation day. After the ovulation day. During pregnancy, there is a progressive fall up till even 2 days after childbirth. In smoking, the smoking decreases the lifespan of the platelets. It increases the aggregation tendency of the platelets. वो एक दूसरे से चिपकते हैं, इकट्ठे हो जाते हैं और उसकी वजह से वो एथेरोस्क्लेरोसिस में काम आते हैं, यानी कि हमारे लिए नुकसानदेह होते हैं. Nutritional deficiencies like deficiency of vitamin B12, deficiency of folic acid and of iron decreases the production of platelets, or you can say affects the blood platelet count. The blood platelet count is increased in injury. इंजरी में स्प्लीन जो है वो अपना कैप्सूल उसको कॉन्ट्रैक्ट करती है ड्यू टू पेन. पेन की वजह से एड्रेनलिन रिलीज होती है. एड्रेनलिन कॉजेज कॉन्ट्रैक्शन ऑफ द स्प्लेनिक कैप्सूल. उसमें स्मूथ मसल फाइबर्स होते हैं स्प्लीन के कैप्सूल में. That squeezes the platelets and the blood out of the spleen into the circulation. आपको पता है 20% platelets were stored in the spleen, so they come out to help कि अगर इंजरी हुई है और कहीं पे clotting की जरूरत है तो the number of platelets should increase in the circulation. Hypoxia. Whenever there is deficiency of oxygen, platelets count increases. Thrombopoietin. This is a cytokine that is produced in the liver and it is released in case of thrombocytopenia. Penia का मतलब है कम हो count. So whenever there is decreased platelet count, thrombopoietin levels increase in the blood. They are synthesized in the liver, and whenever there is a normal or increased platelet count, the thrombopoietin levels are seen to be decreased. इसका मतलब है ये नेगेटिव फीडबैक से इसका लेवल कंट्रोल होता है. Functions of the platelets. They include primary hemostasis. Primary hemostasis is by two processes. One is platelet plug formation and the other is vasoconstriction. Both of them are being contributed by platelets. The platelet plug formation through platelet adhesion, platelet activation and secretion, and platelet aggregation increases the amounts of platelet on the open end of the blood vessel and stops bleeding. Secondary hemostasis occurs via clotting. Third function is integrity of the endothelial wall of the blood vessels. आपने पढ़ा था platelet derived growth factor. If an endothelial wall is broken, the platelet derived growth factor after clotting the blood at that place will be secreted and it will produce repair of the blood vessel. Then there is synthesis of prostacyclins and thromboxane A2. इनके functions आपने पढ़ने हैं अभी. Atherosclerosis. In case of smoking and other cases, the platelets can abnormally aggregate and stick together to block the blood vessels under the they are collecting under the endothelial membrane, and here because of the name thrombus, this is platelet aggregation under the endothelium, so this is called thrombus, and it is going to start atherosclerosis in patients who smoke. So you see this blood vessel, it has been cut at this end and the blood is coming out. You see that the platelets start aggregating, collecting. Aggregate का मतलब होता है collect होना at the end, cut end of the blood vessel, so that the lumen of the blood vessel is narrowed. In number 3, you see that the fibrin threads appear in these blood vessels and they bridge the gap so that bleeding is no more occurring. You will see later on that when the fibrin clot forms, it is later on cleared up and repair of the cut blood vessel will be seen in the future. Hemostasis means prevention of blood loss from a cut vessel. It involves primary hemostasis and secondary hemostasis. So the primary hemostasis consists of vascular constriction. सबसे पहले कट एंड पर जहाँ जो ये जगह है ना, ये इंजरी की वजह से, just because of injury and pain, the blood vessel will constrict itself. Another structure that is called thromboxane A2, another chemical that is called thromboxane A2 will be released here when the platelets start aggregating. अब thromboxane जो है ये thrombocyte से निकला लफज. Thrombocyte means platelets. So thromboxane A2 is released by these platelets that are aggregating here, and it helps in further constriction of the blood vessel. जब ब्लड वेसल के स्मूथ मसल फाइबर थ्रोम्बोक्सिन A2 की वजह से कॉन्ट्रैक्ट कर जाएंगे, ल्यूमन छोटा हो जाएगा, प्लेटलेट प्लग भी वहां पर जो बन रहा है वो भी ल्यूमन को छोटा करेगा और ब्लीडिंग रुकेगी. So primary hemostasis includes vascular constriction and formation of platelet plug. Coming to that, completing the discussion of hemostasis, and as far as its definition is concerned, the secondary hemostasis is actually formation of the blood clot and growth of the fibrous tissue for permanent closure of the hole in fibrous tissue. So the initial response to a blood vessel damage is vasoconstriction. That means this vasoconstriction means the blood vessel decreases its lumen. मसल्स जो हैं ब्लड वेसल के इर्द गिर्द वो कॉन्ट्रैक्ट कर जाते हैं और ब्लड वेसल का जो ल्यूमन है वो छोटा सा हो जाता है. So the initial response to a blood vessel damage is vasoconstriction and sticking together of opposed endothelial surfaces. पहले दूर दूर थी, जब vasoconstriction हुई वो नजदीक आ गई और चिपक जाती है एक दूसरे से. कैसे होगा? Well, first we shall read out this text and then we shall go on to the description of this chart. Number 1, local myogenic spasm. The response to cutting of a muscle fiber is it is injured and it causes contraction of the muscle fiber. Number 2, local factors that are released from the platelets and the injured tissue. They cause contraction of the blood vessel. Number 3, pain at the site of the injury starts a nervous reflex which causes contraction of the blood vessel. And the myogenic response to injury, we have also already seen this is more local myogenic spasm, and for smaller vessels, there could be thromboxane A2. This is a chemical agent. Now let's go to this diagram. The vascular damage causes endothelial surface to have exposed collagen. जहां पर आपने हिस्टोलॉजी पढ़ी है, वहां आप अगर नहीं पढ़ी है तो आप ब्लड वेसल्स की हिस्टोलॉजी शायद पढ़ लेंगे अब थोड़े दिनों में. उसमें ये होता है कि अंदर की तरफ सेल्स होते हैं जो लाइन करते हैं ब्लड वेसल को, दे आर कॉल्ड एंडोथेलियल सेल्स. अराउंड दैट इज अ लेयर ऑफ कोलेजन, and then around that is a layer of smooth muscle fibers, and then again there is a layer of collagen. So the first layer of collagen, that is just beneath the endothelium. As soon as the blood vessel is injured, the platelets which are passing in the bloodstream, जाहिर है ब्लड का पार्ट है ना प्लेटलेट्स, वो ब्लड वेसल में से गुजर रहे हैं, जैसे ही वो टच करते हैं कोलेजन को जो एक्सपोज हुआ है, व्हाट हैपेंस, दे आर एक्टिवेटेड. So this was a cut end of the blood vessel, and the platelets, this whole blue dabba is platelets. Okay? So the platelets, when they are passing nearer to the exposed collagen, they are activated. What does it mean by platelet activation? The platelet activation means that they are going to secrete their granules into the blood, and these granules are ADP. So the ADP comes out, and this blood is acting on the platelets again, and it is causing further activation and aggregation. You see, this is a positive feedback cycle. Apart from this activation and aggregation, the enzymes in the platelets are also activated, and they cause synthesis of thromboxane A2. Thromboxane A2 again acts on the platelets and causes a positive feedback cycle to develop for further synthesis of thromboxane A2. The chemical mediators like ADP and the thromboxane A2, a substance, acts on the blood vessels. This blood vessel is constricted because of ADP and thromboxane A2, and this produces vasoconstriction. The activation and aggregation of platelets also produces a platelet plug. So at this moment, we were studying in this diagram the initial response to a blood vessel damage, and that is vasoconstriction. So the primary hemostasis meant that vasoconstriction will occur to decrease the lumen of the blood vessel, and then formation of platelet plug will block that blood vessels so that bleeding stops. Formation of a platelet plug involves three processes. The platelets adhere to the exposed collagen in a damaged vessel and release their secretory vesicles, which is ADP and thromboxane A2. The two substances help in platelet activation, that is they help the platelets to degranulate. तो further degranulation जो है वो प्लेटलेट टू प्लेटलेट चलती है, फिर एक्सपोज्ड कोलेजन बेशक नीचे ही रह जाए. Activation and aggregation. Von Willebrand factor is secreted by the endothelial cells, and it is also present in the secretions of the platelets. This enhances the attachment of the platelet to the collagen. The platelets are prevented from aggregation at the adjacent normal vessel lining by the release of prostacyclin and nitric oxide from the undamaged endothelial cells. इसको समझने के लिए हम अगली डायग्राम की मदद लेंगे. This is a blood vessel, and here the endothelial cell has been damaged. इस जगह the collagen is exposed because the endothelial cell is not present at this place. When the collagen is exposed, the von Willebrand factor helps in attachment of the platelets to the collagen. When the platelets attach to the collagen, what they do is they are activated. When the platelets are activated, they cause secretion of adenosine diphosphate and thromboxane A2. The adenosine diphosphate and the thromboxane A2 help further platelets in the blood to come and attach to the previous platelet aggregated on the collagen surface. Now, this helps in a positive feedback cycle which causes platelet aggregation and activation, and finally a platelet plug is formed. But you are seeing that the platelets are only aggregating at the cut end and they are not aggregating at the normal endothelium. The reason is that the normal endothelium is producing prostacyclin, this is a chemical substance, and nitric acid. ठीक है, prostacyclin and nitric acid at this place and the negative glycocalyx. आपको हमने सबसे पहले जब पढ़ाए थे प्लेटलेट्स का था कि they have got a negative glycocalyx. Similarly, normal endothelium has got a negative glycocalyx और ये दोनों एक दूसरे को repel करते हैं negative charges. So the platelets are repelled because of this negative glycocalyx on the surface of the normal endothelium, and so the prostacyclins and nitric acid also help in repelling the platelets, not allowing them to aggregate on the healthy endothelium here and the healthy endothelium here on the edges of the broken vessel wall. जहाँ ये platelet aggregation जरूरी है for repair of the blood vessel, for stopping of the bleeding and for initiation of the clotting, वहाँ पर ये भी जरूरी है कि normal endothelium should stay clean and clear in the adjacent areas so that the clotting is not damaging the body by blocking the blood vessels all together. That's all for today. Thank you. We shall be starting blood clotting tomorrow, inshallah. Now, coming to the assignment for this lecture, you will be enumerating the factors that increase or decrease the platelet count, and also number 2 is that you will be making a flow chart in which the vasoconstriction and the platelet plug formation are shown during the lecture. ये दोनों चीजें बना के आपने अपनी असाइनमेंट तैयार करनी है और उसी की बेसिस पर आपको मिलेगा रोल कॉल, और दैट इज ऑल फॉर टुडे.